Thank you, Kathy. I really appreciate being here. It's great to get back to where the work is actually happening. Let me say that prior to coming to CDC, I want to mention this because it definitely informs my perspective on this work. I served for 5.5 years as the Planning and Partnerships Development Coordinator in DeKalb County, Georgia, with the DeKalb County Health Department. I was there at the time when we were first implementing MAP, so 2001, 2002. So a lot of my work and the perspective that I bring to this work comes from that experience. So I think that maybe this event should have been titled The Art and Science of Community Health Assessment and Improvement Planning, because it seems like you're really getting both over the course of the past 2 days. You've gotten some of the elements of science that go into the work, and you've gotten some of the elements of art that go into making the work successful. And I'm here to say I think both are super important. So you know yourself best. You know if science is your strong side, and you know if the art part is your strong side. Depending on where your strength lies, you probably want to exercise the other side in doing this work. So whether that means you do the exercising in yourself, or you look out for people that you can bring onto your team, or partners that you can partner with who bring the complementary experience, I would just say that I think that's really important. So before I go right into the slides, let me bring the latest news on the national front in terms of Public Health Agency accreditation. As of last Friday, there were 98 applicants for accreditation from throughout the country. 12 of those applications are from states, 1 is from tribe, and the remaining 85 are from local health departments. So site visits are being scheduled currently. And I think the exciting news for all of us is that we will have the country's first accredited health departments before the end of 2012. At least that's the plan as reported by FAB. I can't tell you who exactly those applicants are. That process remains confidential. There are some health departments who will tell you and show you pictures of them submitting hitting the submit button. That's how you'll find out who they are, but not because FAB or anyone from FAB is telling any of us who they are. But it's very exciting, and it represents a ton of work among national partners, but even more so at the local and state levels where the work has really occurred to make it happen. Another thing that I want to tell you about is there is a funding opportunity in the field right now through NACCHO, the National Association of County and City Health Officials. It's called the Accreditation Support Initiative. It's funded by CDC, and awards will be made to a number of local, state, tribal health departments, or organizations such as state health departments or public health institutes who support local health departments in pursuing accreditation. I don't want to put anybody on the spot by asking you if you're planning to apply, but I will say the application due date is Friday, and I strongly encourage you to apply. And you are in the perfect position to make this application because you've been thinking about the work that's before you for the past 2 days. This application is literally 4 pages long, and about a quarter of it is who are you, what's your address, your contact information. So the biggest parts of it are simply defining in narrative, 200 words or less, what do you plan to do? And then a little fill-in-the-box work plan. So you've been thinking about this for the past 2 days. You know where you want to go next. And if you think these funds could help you out, I strongly, strongly encourage you to apply for the application. It will be competitive, but it is a simple application. You probably have in your notes what you need for the application. So I won't belabor that anymore. But NACHO, if you haven't seen it, Jennifer can make sure you have the link. I know she sent it out through Tahoe. You could probably get it from the Accreditation newsletter from NACHO or from NACHO's website, or let me know. I'll be happy to send you the link. Pardon? One is the round, yes, under 40,000, 30, 40,000 is the size of the award. What you can do with it, you can work on your prerequisites. So if you are planning a child chip in the middle of a child chip, you can do that. You can pay up to 50% of your accreditation fees if you're that far along. You can work on other accreditation standards, measures that you know you need to meet and aren't currently meeting. And then if you are a public health institute or state health department, you can describe a scope of work about how you will help move local health departments along accreditation. So it is a small opportunity, but a great one if you're in a position to move forward. So let me move on to what I have to share today. I'm just going to talk really briefly about the common elements of a community health improvement plan. You heard definitions from Kathy, so you're understanding what it is and what it's about. This is going to get to what the common elements are of going through the process, and then you'll hear a little bit from our other speakers about how they have moved through the process. Another thing that I think it's important to think about early on is what kind of challenges can you anticipate? What sort of barriers are sort of inherent in this work? Anything worth doing is going to have some challenges that come with it. So we know from some of the folks around the country who've been doing this work what those challenges are. So I want to share those with you up front, so as you hear the rest of the stories and go through the rest of the workshop this afternoon, you can think about how you will address those and what steps and resources you can take to overcome them. And then finally, in addition to the NACHO national resource that Kathy shared with you, I have just a couple of other links that I want to mention. I would be remiss if I didn't say that there are other national and state level drivers for the community health assessment and improvement work right now. Public Health Agency accreditation is not the only one. It's not the only driver, the only interest that's moving this work forward at the local level. Through the ACA law that is now in effect, tax-exempt hospitals must meet some community health assessment and improvement planning requirements. They are actually IRS provisions. Is this familiar? Is this work familiar to anybody in the room? I'm seeing some nods. So if you have nonprofit hospitals in your community, they may be looking at you with great interest to see what you are doing. You may turn your gaze in their direction and look with great interest upon their work. I think ideally, if there can be a coming together so this work occurs jointly, that's the best of all possible scenarios. NACHO and ASTO both, ASTO being the Association of State and Territorial Health Officials, have done some work to describe how local health departments and nonprofit hospitals may work together to conduct this work. It's happening. Those conversations continue to happen. I think you can expect to see more guidance from national associations, be it NACHO or the Association for Community Health Improvement, the hospital side. Federally qualified health centers as well have some requirements related to community health assessment. Healthy People 2020 and the National Prevention Strategy mention it as an objective in Healthy People 2020 as an important part of the National Prevention Strategy. There are other state requirements, not in Texas, but in other states. So there are places that you can look for examples of how the work has occurred. So I like to say this is my from many streams, one river. I don't know if that's a saying in Texas, but it's a saying where I grew up in South Carolina. And this is actually what I like to think of as the river. So no matter what model or framework you use to approach this work, chances are the work is going to involve these steps. So they may be described somewhat differently. They may be named a little bit differently. But basically, you're going to be going through the steps of preparing and organizing, figuring out what your resources are to conduct the work, who your partners may be to join you in the work, engaging the community, which Kathy and Mary did a great presentation on earlier. So how will they be involved in the work? How will they not just be involved, but help drive? Because the idea behind community health improvement planning is it's not owned by the health department. It's in fact owned by the agency. It becomes something that represents the priorities of our community and what we're all going to do together to address those priorities. Developing a goal or vision, conducting the community health assessment or assessments, they can be multiple, prioritizing health issues, developing the plan, implementing the plan, and evaluating the plan, monitoring outcomes, and revising the plan going forward. So it's intended to be an iterative process, and I think you'll see that in the FAB standards as you go through. So here are some of the many streams. You may be aware of others, but here are some of the streams that may come into play. Going back to pre-seed, proceed as a model from the 1970s, there's been a good foundation of work in this country around community health assessment improvement planning. So these are some of the most frequently cited examples that local and state health departments have engaged in. So you may look around and find in your state or through NACCHO examples of sites that have used one or more of these models. I'd like to do a poll in the room just so you can get some idea of the wealth of experience here and have you take a visual look at what some of your resources may be. Who has utilized pre-seed, proceed? Who's done work with that model? Raise your hands high so people can see resources. Healthy Communities model. Great, very good. Planned Approach to Community Health or PATCH, excellent, hands are still going up. Assessment Protocol for Excellence in Public Health or APEX-PH, a few hands over here. Institute of Medicine CHIP framework, maybe not so much, that's more of a reference. MAP was really built around that framework, and I can see there are many hands going up around MAP. The Association for Community Health Improvement Toolkit. Okay, there's one person up front who's used that. And again, that's coming at it from more the hospital perspective, but a very valuable, user-friendly model. The Catholic Health Association model. Your hospitals may be familiar with that. In 2011, ASTO and CDC released a new SHIP planning framework, so I doubt that it's had a lot of practice, but that may be something that some folks are familiar with. It's available on the web. And then there are some state-specific models, Illinois, Healthy North Carolinians, other examples to look to. The next few slides are really, there's a handout. You certainly have the slide here, but NACCHO on their website will have this as a link that you can click on. So this just describes briefly for each of the models that I listed, a brief description of the model, the steps involved in the model, the principles behind it. For example, MAP is a very community-owned, community-driven process, so that's a main principle behind MAP. And then any notable characteristics about it, it's what's listed on these couple of slides. So it's intended to be just a quick way for you to see at a glance some of the similarities and differences amongst those models. So mobilizing for planning and partnership, mobilizing for action through planning and partnership, MAP. Something that I mentioned because CDC continues to support this model through its work with NACCHO. And also, more recently, HRSA is supporting this model for its grantees, and again through NACCHO. So you're seeing CDC and HRSA coming together to provide training and reaching out to folks who are using the MAP model. There is a MAP network that you can reach through NACCHO's website, and again, that's a great place to connect with experienced users and to identify resources related specifically to MAP. And I want to lift it up because it is, at least on surveys that NACCHO does, the most frequently cited model used by local health departments in what they report to NACCHO. So some of the common pitfalls. I think some of these have been touched on already in our conversations throughout the day. Slide. There we go. So time and engagement. One of the things that people say pretty frequently after engaging in this work for a bit is, it takes longer than I expected. We found that to be true in DeKalb County, Georgia, and that we allotted 3 months for our planning and organized process. It ended up taking 6. I think it's kind of grounded in a principle that Mary shared this morning when she said 3 hours of planning work for every hour of FaceTime. The work that happens behind the scenes to anticipate what will partners' questions be, what will community participants' questions be, how will different ongoing initiatives relate? So if there is a juvenile justice planning effort in your community, one of the things that you can anticipate is that'll be one of the first questions that gets asked. How does this relate to the work that juvenile justice is doing? So taking the time ahead of time, maybe that means meeting with them, maybe that means talking it through with folks from juvenile justice or within your own organization to answer those questions or to engage in the dialogue about how those things are going to work. All of that takes a level of time and energy that once done is done and will serve you well throughout the process, but it does take time. So the time and engagement of engaging partners, potentially losing momentum. Somebody mentioned this in an earlier session today. I'm pretty comfortable getting things started, but how do we keep it going? So those are all big questions. Communications, there are a lot of people involved. People who are really close to the process, people maybe further away that you want to be champions of the process. How do we keep the communication flowing amongst all of the people? So that's a common challenge. Resources, and very often it's not a matter of allocating resources just to get through the assessment and planning part of the process, but it's thinking about what resources will be there once we have a plan in place, because that's really why we're doing the work. I mean, sometimes we get caught up in complete the assessment, develop the plan, but the real work is implementing that plan. So we want to make sure that the people resources, the financial resources, all of the resources are there for that. And you probably have other challenges that you may identify for yourself. I hope you'll make a note of those now and bring them up in the question and answer period that Kathy will facilitate for us in a few minutes. So there are some ideas from the sites that we've worked with around how to overcome these challenges around time and engagement. So one strategy for time and engagement is plan to go slow now so you can go fast later. So I think that's, if you want to get it done in 3 months, but it's really going to be a push to get it done in 3 months, plan for 4 or 5 or 6. So the go slow to go fast works in this effort. So build in time to ensure that partners are on the same page. So that may take more than one meeting. It may take a meeting with one person in your hospital, but then a second meeting to meet with that person and their staff or other people that they recommend. So those kind of building blocks of building a relationship, it's almost like a courtship in many ways. If you don't already have established relationships and you're bringing new partners on board, you may think of it that way. Like the first The first meetings, some of the first encounters are, do we like each other? Do we share values enough to move forward? Then you get the second date, and you keep moving through the relationship building. Plan for the lulls in this process. There'll be a lot of energy and momentum at the beginning. People are excited to try something new and different. Once they see your intention really is something new and different, it's going to be exciting. But at some point, that excitement wears off, and there'll be a dip in participation, or people start skipping meetings. I think that's inevitable. One way to pay attention to that is, do you have a core group? Has your organization invested core resources that can keep the work going through those lull periods? Because there will be another surge of energy. It may be a new member who's particularly a champion or excited about something, or it could be a new source of funding that breathes new life into the work and opens up new possibilities. The plan's in place so you can take off. So plan for the lulls, and don't be scared of them. Just build in the sustainability in terms of having that core group and the core resources that are always there. I'm running a little bit short of time, so let me just make a suggestion. Knowing that you have the accreditation support group through Tahoe, that talking with sites who've been through CHA and CHIP in Texas to figure out, okay, how did they plan to engage new partners throughout the process? What techniques did they use? How did they do each of these suggestions, the real practical way that they did it? That'd be a great conversation for a future call. So the communications, I think one of the best tools here is actually another tool from technology of participation, the TOP that Mary and Kathy were talking about this morning. It's called the Circle of Engagement, and it's thinking about your partnership from everybody who is involved in the very core circle, the people doing the day-to-day work, all the way out to who are your circle of champions. So once you've identified where your partners fit on the circle of engagement, then you develop a communication strategy that corresponds with each part of the circle. So the people who are doing the day-to-day work have different communication needs than the people that you want to be champions. So taking the time ahead of time to identify where people fit and what your communication strategy will be for each of those will really help you get through that. And then, of course, allocating does not have to be through the health department. It could be through the United Way, the Boys and Girls Clubs, through your partnership, allocating the resources for implementing your communications plan. And getting very close to the end on resources, part of this work is about leveraging resources. It's about utilizing the health department's resources effectively, but also engaging with partners in a way that allows tapping and utilization of resources in an effective and meaningful way. So having those conversations with partners up front, and I can tell you in DeKalb County, that conversation, I started to feel like a broken record sometimes, because the partners would say, now how much money are we going to have once we get this plan in place? My response would always be, well, you have me and whatever resources the partnership brings, but it was a new way of doing business for us. It may not be for you, but it was for us. So coming back to that, let's put it on the table and share amongst the partners resources for this work was a different approach. And again, thinking beyond getting the plan in place to who is going to implement the plan, who's going to bring resources to bear on the plan. I want to take just a quick pause, and I'd like to ask you to write down one pitfall or one challenge that you're concerned about. So write down just one thing. It may be something I listed. It may be something that just occurred to you. Write down one way that you can think of to address it. And then write down one resource that you've discovered here that could help you. So it could be one of the web links that's been shared. It could be a person you've met, something you've heard about. And in case you were still working on a resource, here's a list of a few more. The ASTO Accreditation resource page, the NACHO CHA-CHIP Resource Center, the MAP Clearinghouse, the Association for Community Health Improvement, and again, that's sponsored by the American Hospital Association, and then the Catholic Health Association. These are all sort of main starting points and great places to look for the work that's been done and resources to support. And that's all I have right now, so I'll turn it back to Kathy. Thank you.